So there's a lot of data, again, that shows that while all alcohol is not truly bad, certain alcohols definitely are more detrimental than others.
Welcome to another episode of WeDriveHealth podcast. I am JT, and we are steering health forward. I'm here with Dr. Nate.
Yes, sir. Yes, sir. Dr. Nate here. Grateful to be here. Another day, another dollar, another blessing.
Another blessing.
Another
we're
blessing.
not concerned about the dollar right now.
Don't worry about the dollar today. All right, that's fair.
We'll worry about it after the episode.
That's fair.
After the episode. Yeah. So as I said, I'm kind of see that you kind of fresh today. You're not in the scrubs. You're in the J's.
I mean, here's the first mistake. I'm fresh every day.
True.
Doesn't
True
matter
story.
what I'm rocking.
True story.
But I feel you. I am wearing Jordans today. Usually I'm wearing some kind of like shoes, loafers, something in the office.
With the socks.
These little, and I got the sock.
You got
game
the socks
on?
on?
Lock. Yeah, I got the sock game on lock. But today is just the Jordans. That's really the main focus.
That's the focus.
Yeah,
Nice.
yeah,
Okay.
yeah.
So as you know, I want to do a Ask Dr. Nate.
Yeah, let's do it.
We got a lot of good feedback from that. A lot of people love it, so
Yeah.
we're gonna keep that going. So
Yeah.
this will be one of the things that we do every episode.
Let's go. Let's do
Not
it.
every episode, you know what I mean?
Yeah.
All the time.
As
right?
frequently as we can. Yeah.
Exactly.
Yeah.
So first question: what are the warning signs of serious health problems I shouldn't ignore?
So that's a good question. So, I always remind patients that sometimes we have subtle things that are happening in our bodies that you're like, maybe it's concerning, maybe it's not concerning. But some things that I really want patients to just take account. So first things first, when we address everything in primary care, we go from head to toe.
Mm-hmm.
So I'm going to break it off into like a body system, right? So headaches, when to ignore it and when not to ignore it. So headaches, majority of us experience headaches.
Mm-hmm.
Hunger headaches, dehydration, could be a little bit of stress.
Is it like sleep headaches? Is that a thing?
Sleep headaches when we have poor sleep quality.
Yeah. Okay.
So those are very important ones, but I mean, we know the cause of it, right? So those are the ones that I tell patients not to be too nervous about. Very important to still acknowledge it, but you already know what is causing it. But things that are a little bit more concerning about headaches, for example, right, are headaches that come out of nowhere, right? You're just doing your own thing, and all of a sudden you get a sudden, we call it a thunderclap headache, sudden onset of a headache.
Thunderclap.
It's like thunderclap. Something just knocked you out.
Right.
And so that's a little bit more concerning.
So are we talking about like a pain scale from like, if we're doing a pain scale 1 to 10, right?
Yeah.
Like, what are we talking about?
Yeah, we're talking about 8, 9, or 10.
Oh, okay, okay.
Very severe.
Very severe. Got it.
Yeah, and usually there's some kind of manifestation. When I say manifestation, your eyes become a little blurry. You're tearing up at the eyes out of nowhere. So those are the types of things that you're like, oh, this doesn't sound like something I should ignore.
Got it.
So that's one thing. Other things, right? If I'm going down through the body systems, if you have any chest pain, right? We talk about chest pain quite a bit of times. For men and women, there are two different manifestations of chest pain or cardiac problems.
Right.
So men typically have the typical sign of something heavy sitting on my heart. So remember, the heart tilts on the left side, so all your manifestations kind of on the left side, numbness tingling down the arm. Those types of things, let's not ignore that, because that seems pretty important. For women, when it comes to cardiac, it usually is not chest pain, but it's usually just random sudden onset of something. Could be epigastric pain, which is like this reflux sensation that radiates to the back. It could be just left arm numbness all of a sudden that comes out of nowhere. I had actually a crazy case. This lady came in for left elbow pain with no other symptoms.
Yeah.
She didn't pick up anything heavy, no groceries, nothing, just left elbow pain. Her story was just so weird and bizarre. Like, why are you having a left elbow pain, right? Like, you're not falling down a flight of stairs. You're not picking up anything heavy or throwing it across the hall, right? So something prompted me to do an EKG, and she was having a heart attack. That's all it was.
Wow,
Yeah.
that's crazy.
It
That
is
you would
scary.
actually like that. But that's good nursing skills, though, right?
Right, that's exactly it. Like you got to
the
really
story
understand
doesn't add up. Let me do an EKG.
Right. So these weird manifestations where it doesn't make sense are the things I always mention, and this is two big ones. When patients are going to the bathroom, number 2. Sorry if you're eating right now, right? But you're pooping blood. That's not really normal, right? But some people are like, oh, could it be hemorrhoids? And they kind of ignore it, and they kind of get the story mixed up, and they think it's hemorrhoids, and they assume that it is. And there's probably something else going on.
So, like, let's just say you have one bout of it, right?
Right.
Like one bout of blood, whatever case may be.
Yeah.
Nothing to be concerned about. Or if it's 2 or 3, then it's something that you should be like, okay, something's wrong.
So usually, if you're wiping and you notice it, but it's not a crazy amount in the toilet bowl, that's not to be concerned about. That's one episode, just watch it, right? Especially if you strained, like you're pushing, you're going to the bathroom, you're really, you got the sweat beads coming, you got the veins coming through your forehead.
Sweat beads, not
it
the
looks
sweat
like you're about
beads.
to give birth and you're like sitting forward regretting your life, right? Like those types of bowel movements, and then you wipe and then you notice that, more than likely it's hemorrhoids, one episode, okay.
Got it.
Fine. But if you're telling me that the whole toilet bowl is filled, there's no reason for it. You didn't eat anything red, and now all of a sudden the toilet bowl looks a little crazy. That's usually a red flag.
Got it.
Yeah.
Got
yeah.
it. Got it.
Yeah. And then the last thing is, I mentioned this before in the previous discussions about men's health.
Right.
But erectile dysfunction, especially for men, obviously for men, that's usually a red sign or a red flag, right?
Right.
It could just be a multitude of reasons why that happens. Could it be cardiac? Could it be diabetes? Like things that you really need to investigate. So I usually tell men, don't ignore that part. Just come in and get it checked out.
Got it.
Yeah.
No, that's actually really... All right, so next question. How do I boost my immune system to stay healthy year round? Obviously, this is the winter time. Everybody's sick.
Right. Yeah. Half the office, they being clapped out. Everybody's being checked out. Like they coming in looking pale, green, blue, indigo, violet, because they look like they're tired and they're sick and they're coughing and they're a little nauseous. So that's always a good question. So, that the gold standard is the hand washing. People always forget that. COVID made it a very apparent thing.
Sorry. Fellas, wash your dirty hands.
Dirty.
Yo, I see y'all.
Yeah.
I see y'all.
Going into the bathroom.
Listen, only because I've changed ways, I don't call people out anymore. But I used to call people out.
Yeah. I have a list.
Wash your dirty hands, please.
Yeah.
And thank you.
Right.
Carry on.
Thank you for that public service announcement. That was much needed. Yeah, so washing your hands. I mean, that's the number one way to do it. You could go ahead and prevent a lot of sickness and respiratory infections related to that. The particles love to sit on these types of surfaces for a period of time. There's a lot of data that shows that for more than 20 minutes and even longer, these particles can sit there. So that's a concern. Second thing is keeping mindful of your diet, right? So antioxidants are very good. And everybody thinks antioxidants are, I will just say antioxidants are berries. I'll just start with that, right? This is simple enough. You incorporate a lot of berries and antioxidants. Those promote very, very good strong cells that prevent being susceptible to getting sick.
So give us examples.
Yeah. So you go ahead and blend berries, strawberries, blueberries, stuff like that on a daily basis. It keeps the inflammation markers down in your body.
What about the wine?
The wine, one wine, one glass is okay, you know what I mean? But the wine itself may not be enough because the berry content should be just frozen berries.
Got it.
Right.
Got
So
it.
I would just keep that in mind. The third thing is zinc and vitamin C. So zinc and vitamin C, they work really well together. So when people say, hey, I'm just doing vitamin C alone, I always remind people, please add that zinc. The zinc will be very, very beneficial.
Got it.
And then, of course, our parents, the elders, they've been saying this. You do ginger tea, you do a whole bunch of turmeric, all of these other things. Shout out to our parents.
Yo, tea cures all.
Yeah, tea cures all. You know what I mean? So, I mean, there's some truth to that, right? It just keeps the cells healthy and it keeps the inflammation down in the cells so they're prepared to always fight whatever's coming our way.
Got it.
Yeah.
Okay. Yeah. So next question that we received is what's the role of caffeine and alcohol in my overall health?
You're talking about caffeine right now.
Caffeine and alcohol.
And alcohol, right. So I'll tell you this. There's a lot of pros and cons to caffeine, all right? So there's some data that suggests that black coffee once a day actually prevents you from getting Alzheimer's.
Yeah, I've been reading about that as of late, so that's interesting.
Yeah, so when we say black coffee, we mean black coffee alone because it gives tremendous amount of of concentration and focus, that the thinking is that the brain will get so adept to it that now all of a sudden it'll carry you through as an adult and when you become a little bit older.
Got it.
This is where we mess up though. We don't like the black coffee. It's a little sour. It's an acquired taste, right? So we start decorating the coffee, I call it, and it's no longer coffee. We start throwing a whole bunch of milk and sugar and all of the other stuff. So I think that's when it becomes dangerous. When we have more than 1 cup of coffee a day, that also becomes dangerous, right? Because caffeine is a diuretic. And if people don't know what diuretic means, it means it induces the will for you to want to pee a lot more. And then the challenge becomes, okay, if I'm peeing more, am I drinking more water to kind of counterbalance that, right?
You become dehydrated.
There
right?
you go. So I think that's really where caffeine starts to become more of a problematic as opposed to it being actually beneficial. Now, in terms of alcohol, man,
that's a whole
nother conversation. So, I'm guilty of this. I would go out and I would drink maybe 2 glasses of bourbon, right?
Ooh.
And I know I'm a fancy man. I'm a fancy man. I'm fancy guy, classic man here. You know what I mean? So not good, right? Because the actual quality is actually the actual choice of what you're drinking becomes a challenge.
Got it.
So there's a lot of data, again, that shows that while all alcohol is not truly bad, certain alcohols definitely are more detrimental to others. Anything that has more sugar content, for example. Right. So bourbon being a big player, any of the flavored tequilas are a big problem. Any of the flavored vodkas. So anything that's darker in terms of liquor is usually a challenge. So the Henny.
Always the dark stuff.
The dark stuff is a problem, right? But then the lighter stuff that has really unflavored stuff, like basic vodka, 1 glass is okay. Once you start to drink more, then it becomes a little bit of a challenge. It's really risk versus benefits at that point. Wine, 1 glass a day is completely appropriate, but we also started doing some research or seeing some research that says that certain red wines are sweeter than others, right? There's port red wine. That's sweet. That's a lot of sugar content in it.
And especially such a small glass.
It's such a small glass. So I usually caution patients, to keep the wine kind of in the middle in terms of the sweetness, right? If you could just make your wine a little more on the sour side, then you're getting more benefits from wine. Wine is usually very good to decrease your blood pressure at a certain point, but when you start to overdo the wine, then the blood pressure actually starts to go up.
So it's the same thing, right? Like caffeine, like once you overdo it, it becomes an issue.
Correct. Exactly.
Got it. Same thing with the alcohol. Well, anything to me is once you do too much of anything, then it's even it's water.
Right.
Like people don't understand once you drink too much water, it becomes a problem as well.
Absolutely. Yeah.
Okay. So I got a question.
Sure.
So let's just say that I drink 5 glasses on Monday.
Right.
For the rest of the week, am I good, or is it too much for the body to sustain? Or it's better to over.
No, I get it. So this is a question I get a lot from patients when we're talking about alcohol, right? They're like, I don't really drink that much. I drink socially. Well, how social are you, right? Like, we're all social in different ways.
Right.
So, the once a week is what people tend to mention when they say social, which is the example that you probably provided, right? Monday through Friday, maybe Sunday through Friday, I don't drink. But then on Saturday, I'm hanging out with my friends, hanging out with my boys, and I decide to drink 4 or 5 of whatever I'm drinking. Still a bad thing. So this concept is still considered binge drinking, right? Because in a short period of time, you're consuming quite a bit of alcohol, and of course, the alcohol content or what's in the alcohol is very dangerous. So for my men who want to work out, and men and women, right? Everyone asks, because once we get to a certain age, we start developing the little bit of the beer gut or that little, the little pouch. And they're like, what can I do to cut that out? And I'm like, you'll be surprised. It's really just cutting down on the alcohol tremendously. The sugar content. So men, beer, I know that this is something that we're guilty of. We watch football on Sundays and we're drinking 2 or 3 bottles of beer. And you quantify that as a man. I don't really drink much. I only drink during certain occasions.
Right.
That sugar content will sit in that belly and really just sit there. And that's how that extra adipose tissue, that fatty tissue sits there. And that's a very stubborn fat to get rid of. So really cutting it down to 1 a day. tradition or session or whatever the case is.
So my next question, follow-up question, is more so like, how long will it take? Let's just say like I drink 5.
Yeah.
How long is that going to take to come out of my system where it's not having an effect on me as well?
So there's different types of effects.
Mm-hmm.
So there's the weight gain effect, right, which is the central weight gain that we talked about with the belly. But if we're talking about just the other effects physiologically in your body, right? So it takes about 8 to 12 hours for alcohol to clear out of the body or start to clear out the body. But here's the problem. We drink in our 20s, it clears out of our system much faster, right?
Correct.
Like the hangover, you could drink 6 to 12 hours later, the hangover, you're good, right? But when we start hitting our 30s, that recovery time is crazy. And people don't understand that our metabolism by nature slows down.
Right.
So now that 6 to 12 compounds, it doubles. You do it when you're in your 40s now, it triples, right? So it takes much longer to recover than when we were in our 20s because our metabolism by nature is much faster.
Got it.
So it really becomes more problematic when we start hitting our 30s. And we still think that we can drink how we used to. We can't. The recovery time takes much longer.
Got it.
Yeah.
Sheesh,
Yeah.
that's crazy.
Yeah.
All right, last question, and I guess you said you're dealing with something like this today, right?
Yeah.
What's the safest and the most effective way to recover from injuries?
Yeah. So I'll tell you this. Again, this is one of those things where we think we're invincible and then your back goes out one day.
Yeah, and it's lingering for forever.
Your back goes out. Your shoulder, suddenly you have this rotator cuff problem, right? Like you can't do this full rotation all of a sudden. And you're like, yo, I'm old. Like nothing humbles you more than having some type of musculoskeletal, back pain, arm pain, extremity pain, injuries. And it's really a result of 2 things. Either we overuse something, right? So the sport injuries happen because we're overusing or putting tremendous amount of weight over repetitively without stretching in between, without doing something to kind of help that muscle relax. Muscles are supposed to contract and relax. That's how it's supposed to work.
Right.
But when we put tremendous amount of weight on that muscle and it doesn't have the recovery time to relax, and then we keep compounding it with more and more weights, we're now adding increased risk for injury, right? So really the case becomes you need to relax those muscles, right? And this is why it's very important for people to not skip leg day, right? Because you're supposed to work out different parts of the body different days so that you could allow the other parts of the body to relax and rest. Now, in reality, things happen, right? And I think really what happens is we don't stretch. We just don't stretch. We should be waking up the muscles in the morning to innervate them, to prepare them for the day ahead. Many of the back pain and the arm extremity pains that I've noticed with my friends and with certain patients our ages now is picking up their heavy babies, right? Like they're picking up their babies, they're putting them down, they're doing all of these twisting motions and they're not stretching. They're not really expanding the muscle groups to allow the body to be able to do all of these types of things. Picking up groceries, all of these little things that we minimize, these are weights that we're adding. So it's a lot of these types of things that I have to remind patients. You got to be very careful.
You know what? That's actually really good point. Like just a simple stretch, right? Like you wake up, because in the morning, typically when you're like, even that like you feel like well, at least me, I'll talk about me. Like I hear all types of cracking and
right.
Mercy.
Yeah.
This shit is so good.
Yeah.
So no, I think that's actually really good. I think for me, like I remember one time I was squatting and I don't know, I re-racked it the wrong way. Yeah. And bro, my back pain, like I couldn't move for like a good 2 hours. Luckily, John Jay was there. Yeah. And he shout out to John Jay, because I was like, bro, I can't move. He was like, all right, let me stretch. He was working on, how John Jay. When he started going, he but I say all to say that the next 2 days I couldn't sleep. Yeah. And I worked on pain units before, and I didn't know. Yeah. Back pain is the most uncomfortable pain because you can't sleep properly. It's like there's no position that feels good. So listen. You know what they say? They say you never forget your first, right? And y'all think we're talking about sex. No, you'll never forget your first really severe back pain. Bro. You'll remember where it was. Game changer. You remember exactly the conditions that got you there, and you remember hopefully how you're able to get out of that, right? Yeah. So and I want to make sure that people don't judge people who are dependent on pain medications. When you're in pain crisis
and you're trying a whole different modalities, and then you suddenly realize you get to the point where you keep coming back to the provider and they end up throwing this heavy duty like a Percocet at you,
right? And
you suddenly go from a 10 out of 10 pain to 3 out of 10 pain,
right?
I understand why it could, what the appeal is with these types of medications, right? Because now you're finally getting your quality of life back, right? Now here's the challenge, and this is what I tell patients. There are practical ways to restore and get your back pain and all your aches and pains back to life, right?
Right.
We, shout out to John Jay. There's stretch therapists, right, that are out there who really, this is their job. They assess and realize, hey, you're stiff in this muscle group area. Let's show you how to stretch. And then in the mornings, you can only devote 5 minutes, just 5 minutes. That's all it takes to really just lay on the floor and do some stretches that will benefit you for the whole course of the day, right? So there's yoga, right? Shout out to Lisa, who we're gonna have discussions with her at some point. But the plan is that you do these simple things, it will set you up tremendously.
Right.
Improve your quality of life, prevent repeat back pain crises, right? There's heat, just doing something simple as applying heat to the back, just to relax the back.
So now I've been hearing like mixed things about the heat and cold and stuff. So you want to touch on that really quickly?
That's a very good question. So when you immediately hurt yourself, the thinking is that you alternate between heat and ice for the first 3 days. Okay? Because there's a lot of things happening inflammation. Inflammation is happening. The nerves are like on 10. Like everything's just innervating, and you don't know, your body doesn't know yet which way to go in terms of what's going to help it relieve. After 3 days, the thinking is that heat works better than ice or anything cold. There's always some caveats to the rules. If you are an athlete and you continue to repeatedly use that pain place, if you're a football player or whatever, and you're throwing a ball or whatever the case is, and your shoulder's always out, right? But this is your livelihood, then we tell patients to continue alternating between ice and heat.
Got it.
But for the everyday man, you blew out your back. The first 3 days, alternate ice and heat. After the 3 days, you then continue to use heat. Heat is just
your friend,
for
right?
That. Yeah.
Got it. Okay,
Yeah.
perfect. Well, that was actually pretty good.
Yeah.
If you guys have any questions that you want us to answer, please put them in the chat. Comment and subscribe. The goal is to really push health from different perspective. Most of the time it's just primary care, but we want to talk all different modalities of health. Health is not just the body, but it's the mind, the spirit, all the above. So if you have any questions, just please put them in the comments for Dr. Nate. Until next time.
Live
long and prosper.
Here you go.
Scene 1, take 3. Action.